Hey, it's Raj from 3CB Performance. Warriors guard and superstar Steph Curry has been out for nearly 4 months after suffering an unstable second metacarpal fracture of his left hand versus the Phoenix Suns in late October. After multiple surgeries and continuous rehab, Steph continues to progress towards a return date of March 1st potentially. However, he recently mentioned that he's been dealing with, quote, nerve damage and that it, quote, feels different. In this video, I'll explain what that means, the recovery process, and if it's concerning moving forward. The hand is innervated by 3 nerves and subsequent branches: the radial, median, and ulnar nerves. Each of these supplies both motor, movement, and sensory, sensation or feeling nerves to specific regions on the hand. The innervation is really dense with multiple superficial and deep branches due to complex hand anatomy and its frequency and variety of uses. To that point, the representation of the hands in the brain's homunculus, a sort of neuron brain map of each body part, is disproportionate to the actual physical size of the hands. The 280-pound Aaron Baines falling on Steph's hand can commonly cause nerve injury. These injuries are classified into different grades based on severity and recovery potential. Nerve pain, aka neuropathy, in sensory nerves can feel like burning, tingling, and/or numbness, whereas motor nerve neuropathy may result in loss of motion and decreased strength, often accompanied by muscle twitching. Further, cutting through the skin during surgery can lead to irritation of the superficial sensory sensation nerves, and immobilization can further exacerbate both sensory and motor movement nerve deficits in the short term. The key thing to understand with recovery is that mild nerve damage doesn't mean the nerve is impacted forever. Rather, like a muscle or joint injury, you have to rehab it. In Steph's case, that likely means continuing to use the hand to stimulate motor nerve pathways, desensitize sensory nerve pathways, and simply get comfortable using it again, progressing from low-level activities to higher-level activities. Accordingly, he's been ramping up on-court activity progressions and participated in his first scrimmage on Saturday, February 22nd. The hand looks pretty healthy here as well. Mild nerve injuries, especially after crush-type hand trauma, aren't uncommon. I'd actually be more surprised if Steph wasn't dealing with a nerve issue. If he did have a more severe nerve injury that was actually affecting function, he almost assuredly wouldn't be returning this season. Additionally, as Steph elucidated himself, any body part is going to feel different after surgery and take some time to feel normal. That's a normal part of the process, and especially so for a body part like the hand, which we use so frequently and is constantly in harm's way. The main obstacle for Steph right now likely isn't the nerve symptoms, rather it's regaining full strength and mobility in the hand and seeing how it responds to higher intensity contact. As he gets back into games, I fully expect for him to become more and more comfortable using the left hand and at some point likely even forget that it feels different than the right. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis. You can always find me on IG and Twitter at 3CB Performance. make sure to sub to the channel and follow along on all social media for the latest updates. 3CB out.